I'll first go to the chat. There's a number of questions there for Dana. You lit up the chat, all very complimentary. But I guess two of the issues highlighted are whether you were able to make any comparisons between sharing of mental and physical health data, and also whether there were any sex differences.
Okay, thank you very much for the feedback. In context to the mental and physical health data, we didn't focus much on physical health. This was just something that we asked in one of the last questions about general data sharing. What I can say is that there wasn't a big significance between that and their willingness to share mental health, much like, as you said, Andrew, that it's pretty similar to adults, but it wasn't very much explored. And when it comes to sex differences, unfortunately, we couldn't do that because there were only about 120 males in this survey compared to close to 1,600 females, which is always the problem with those types of surveys, which is why in the conclusion I said one of the things we would want to try and focus on in future is getting a male perspective on these issues. So unfortunately, we couldn't do that comparison. Do you want me to answer the other questions, or do you want to move to something else?
And I think as well, there's for self-harm, which a lot of our respondents had a history of self-harm. There is a huge differential in females and males, so you would expect some of that gradient. We'll come back. I wanted to ask Jan whether so where you see that protective effect of having a hospital admission, and in some ways I find that reassuring, because it sort of identifies to me that maybe something happened with safeguarding and other services after that admission.
Yeah, I think that's probably it, because it's somebody, I mean, to some degree, probably the data reflect, we don't know when somebody's admitted for self-harm, we don't know whether that was a suicide attempt or whether it's self-harm for whatever other reason. So it's hard to disentangle whether these are people with suicide attempts who then get seen by professionals and sort of are able to have some kind of successful intervention or treatment or whatever further on, or whether this just reflects people using less lethal methods, or to some degree there's also a sort of a confounding between urban rural status and the proportion of people who actually had a hospitalization. So it does sort of look like people in urban areas were more likely to have had a hospitalization in the first place, and that might be partly driving this.
And with the accidental poisonings, do you think that's like a marker of neglect or family context?
Potentially as well, yeah. So again, it's hard to disentangle whether it's an accidental poisoning. I think could be something like an overdose being seen in the hospital where the person wasn't conscious, and so the clinicians couldn't get any information about it. But it will contain some proportion of cases of children, say, getting access to their parents' medicine drawer or whatever, and then so it's. I think it's again, it's hard to disentangle these cases, especially when we're looking at sort of big reams of data like that. Yeah.
So Dana, pulling on, so I've asked Andrew and John's questions. So going to Kareem, do you think what are your thoughts on young people and consent and anonymized data such as in SAIL?
Well, consent did come up a lot, and all kinds of ethical procedures that they wanted met. But when we specifically asked them about how they felt about anonymized healthcare data being used, then I think it was one of the questions where the percentages were the highest in their willingness to share, because it was 91% that said yes, that they are, if it's anonymized, they're fine with it. And there was another question that supported that when we asked them about, we gave them certain measures, and one of them was if their name was removed, would that increase? And that also was, it shooted up and increased their willingness to share. So I think they mentioned consent a lot. what I felt from looking at that, because a lot of it was open text as well. So what I felt was that they just want ethical procedures to be met and for it to be anonymized, and they're fine with it then. That was the general feel from the survey.
Thank you. So final question to Lewis. So what was your feel for the differences in impact of cyberbullying compared to in-person bullying? If I had to put you on the spot and say, what do you think the answer is?
So I think, well, probably, yeah. I've covered in the possible explanation for, you know, it's not easy to disentangle the effects between these two because they are closely related, and there could be also dynamics between cyberbullying and in-person bullying, because children or pupils, you know, they could be victims of in-person bullying at school, or when they go back to school, when they go back home, they could be possibly be a perpetrator of cyberbullying. So these, it's not easy to, you know, using well, I mean, if we can have more longitudinal studies, you know, more follow-up to the dynamics of bullying, also perpetrator and victimization, and also to also link other psychosocial factors like loneliness, like other mental well-being, we may have a better picture.
Brilliant. I know that I have missed Andrew's question on industry, which really relates to DataMind as well. So I'm going to ask Dana if she can answer that in the chat, but we can also follow it up with you, Andrew. So I'd like to thank all three of you. I think all three are really fascinating in their own way. So there's the uniqueness of the data linkage in Jan's study. There's the uniqueness of the longitudinal follow-up following a survey, which is a real weakness in the cyberbullying literature. And then I think highlighting the attitudes of young people, but particularly the sort of young people that we want to work with. So those with mental health problems, those who self-harm, and the use of their data and social media data is vitally important to the field. So thank you all. And I'm going to hand over to Dermot.